Thank you everyone for attending today. This is the Planning Data Archiving and Reuse with HMCA webinar. So for our agenda, we will do some introduction to the staff on the projects, to RWJF's values and goals, to ICPSR's HMCA activities, and I'll leave time to answer questions at the end. So introductions. So the HMCA project director is Amy Pienta. She's a research professor at ICPSR, and at ICPSR, she oversees collection development and directs several large data archiving projects, including the Health and Medical Care Archive. Amy Pienta has studied women's retirement behavior, the joint retirement behavior of married couples, and the relationship between various social statuses and health. And I'm Sarah Britt. I am the Health and Medical Care Archive and Patient-Centered Outcomes Data Repository Data Project Manager. I've worked at ICPSR since 2009, and I currently manage these archives in addition to some long-term data acquisitions projects, such as the Qualitative Data Sharing Project. Our project officer or program officer is Carolyn Miller. She's a senior program officer at the Research Evaluation and Learning Unit. She joined the Robert Wood Johnson Foundation in 2013, and she brings to the foundation a long and diverse career in private sector, government, and academic research. She views her work with RWJF as an incredible opportunity to be a part of guiding and supporting the research efforts of the foundation as it helps to move our nation toward a culture of health. And we also have Leah Carey. She is a community health researcher by training, and she's passionate about improving the social determinants of health as a means of addressing disparities in health and well-being and advancing health and racial equality. So on to RWJF's values and goals. So in partnership with other, RWJF works to develop a culture of health rooted in equity that provides every individual with a fair and just opportunity to thrive, no matter who they are, where they live, or how much money they have. To advance health equity, they invest in 4 broad areas: health systems, which are bringing key health systems together around a shared goal of better health for all; healthy communities, which is supporting initiatives that help communities reach their greatest health potential; healthy children and family, supporting research and programs that expand their understanding of growing up healthy; and leadership for better health, helping leaders address health challenges across the nation. As part of Robert Wood Johnson Foundation's commitment to transparency, the importance of access to evidence, and to the field of social science research, the foundation makes public RWJF-supported research data that can be used for the purposes of secondary research by other research institutions or individuals through HMCA. So ICPSR is where HMCA is located, and it's an international consortium of more than 865 academic institutions and research organizations that provides leadership and training in data access, curation, and methods of analysis for the social science research community. In 1998, the Health and Medical Care Archive was created with resources from RWJF to store data from research in the healthcare funded by the foundation. And ICPSR's relationship with the foundation dates back to the early 1980s. So RWJF grant funding supports ICPSR to expand and maintain the HMCA collection, curating and preserving their research, and importantly, providing free and open access to the data in HMCA to foster new use and research with this data. The Health and Medical Care Archive is at ICPSR, which is located at the University of Michigan. We preserve and disseminate this data collected by selected research projects, and we facilitate secondary analysis of the data. The data collections in HMCA primarily include large-scale surveys of the American public about public health, attitude towards health reform and access to medical care, surveys of healthcare professionals and organizations, public health professionals and nurses, evaluations of innovative programs for the delivery of healthcare, and many other topics and populations of interest. And our goal is to build a culture of health by increasing the understanding of health and healthcare and the factors that contribute to health in the United States through secondary analysis of these data collections. Our specific activities that we do around this, as I spoke about, are preserving and disseminating the data on these topics, providing access to over 300 data sets currently and growing, and accompanying documentation for secondary data analysis. And of biggest note is that our data is available for analysis free of charge. So a little more about ICPSR's HMCA activities. This screenshot shows the landing page for the HMCA website. The area highlighted by the red box provides ready numbers to show HMCA's breadth, including the number of studies currently available from HMCA, the number of variables in these studies, and the number of publications in ICPSR's bibliography based on the use of data in the HMCA collection. We also list our current data releases and our news headlines on the website, where you can find information about other webinars that we might be doing and even recordings of webinars afterwards. Another section of the website that I wanted to point out is the Find Data tab. The navigation is circled in red, and it's a great place to further explore the data collection at HMCA. You can list all studies, you can browse by subject, or review some quick FAQs for searching. Access methods become increasingly restrictive as the level of data sensitivity increases. And later on, we'll discuss the importance of that and thorough metadata, which is part of how these data collections become discoverable. Highlighted in green is a special feature of HMCA where additional data-related resources can be found. Once again, that includes our workshops and webinars and the materials associated with that in the recordings. This is what that additional resources page looks like. HMCA offers the opportunity to do webinars or workshops that dive deeply into specific data sets or series. If study teams have availability and interest, doing a webinar or workshop is an easy way to generate traffic to the study homepage and increase its reuse or impact. The training and workshops can be held online or in person, such as at a conference. HMCA provides coordination services, but also provides additional services specific to data webinars, such as the ability to ask pre-registrants questions to gather more information about the audience, or to do an application process or screening for things like a bigger workshop. And if you're interested in a training or workshop, you can reach out to HMCA staff. I'll put our contact information on the last slide. And planning typically starts about 2 to 3 months prior to the event. So if you know you want to give a webinar in the spring, then we should start talking about it during the winter. There are specific archiving criteria for depositing with HMCA. RWJF designates certain grantees to deposit a data set with HMCA, and which ones are selected for archiving by them are primarily data being collected over the course of their grant that has potential for secondary analysis, can be made available as public or restricted use, and the data collection follows rigorous industry standards and meets one or more of the listed criteria below. These criteria are that it's primarily quantitative, so that excludes focus groups, key informant interviews, or other small scale or qualitative research. Although that may change in the future, RWJF is looking more into sharing qualitative data as other organizations are requiring that as well. Another criteria is that the data are national in scope and that they're representative of regions or states if other criteria are met, such as large sample, evidence of important variability and outcomes being studied, or a hard to study smaller targeted population that may be of particular interest to researchers. Sometimes we do other smaller geographies such as county or city, but only if the sample size is large enough to be of interest and to be used by others for secondary data analysis, or if it's a validation of previous research, linkages to other data collections, or if it's a replication data set. And data sets not meeting the criteria above might still be considered on a one-off basis through the program officer. So this is our deposit data page. HMCA shares ICPSR's deposit system, which provides secure upload of files and a form for describing the data collection. To begin your deposit, you would click on the Start Deposit button circled in red here and make sure that HMCA is selected in the Archive drop-down menu. It should automatically be populated, but it's good to double check. But we're getting a bit ahead of ourselves. The section highlighted in green is called Help with Depositing Data. These documents provide things to consider before starting your deposit. So RWJF grantees can take a variety of steps to help expedite data through the archiving process. These steps also improve the quality of data files available to the original research team and enhance the collaborative research efforts well in advance of depositing data with HMCA. Many steps necessary to prepare data for secondary use are best done by the data producers who have intimate knowledge of the data. To facilitate secondary use, it's important to fully document variables in the context of the data file as well as in the codebook. When preparing the data for archiving, please remember the following. So these are the tips listed here. Address confidentiality regarding the data before deposit according to the safe harbor method or the common rule. That includes things in removing protected health information or personal information such as geographic information smaller than state, or such as an address. All elements of dates except for dates directly related to an individual, for dates that are directly related to an individual, including birth date. For the second tip, we suggest creating new ID or case identification variables for the anonymized data set. ID variables in character format are recommended as most statistical software sort and match character format IDs faster than numeric IDs. Also, character IDs are better retained between software packages. If the data collection consists of 2 or more related data sets, clearly identify all identification variables needed to link the data files together and explain the relationship among the files and the variables in the documentation. The third tip is to define all variables as numeric whenever possible, except for ID and date variables. A wider range of analysis can be performed with numeric variables. We also suggest that you convert data files to 1 record per case. Complex record structures, multiple records per case, hierarchical or mixed record types are difficult for most users and cause difficulty both for ICPSR's automation process and for software interoperability. For example, if individuals at institutions experience more than one event, such as a hospital visit or a doctor visit, create a person file that includes all of the events on the person record. Likewise, if a doctor visit file included lab tests with individual results attached to those lab tests, structure the data so that the doctor visit is the observation and each lab test and its results are recorded as variables on the doctor visit record. We also ask that you assign a set of exhaustive, mutually exclusive codes to each variable and use the same codes across variables, recording the same type of response. For example, 0 is no and 1 is yes. Provide each variable and each code with descriptive labels in the data file, the SAS, SPSS, or data file, or whatever package you're using, to aid proper understanding of the data content. Secondary analysts rely on the data file to provide the majority of the information they use to analyze the data. Despite the best attempts to convince users to read documentation carefully, often they might miss something. Review labels for comprehensibility and to make sure they clearly describe the information or question recorded in that variable. If labels in the data must be abbreviated due to length limitations, the full information should be provided in the codebook, data collection instrument, or other documentation. We also suggest assigning separate missing codes for non-applicable, non-response refusals, and other types of missing data. You can use numeric codes because special missing characters are often lost when converting between software packages and in the preservation formats such as ASCII. If retaining blanks, system missings, the documentation must identify what type of missing data the blanks represent. We also ask that you deposit transformed variables or variables that were constructed or derived from other variables. For example, scale items may be scored in using the scale algorithm and stored in 1 or more summary scale variables. Assign labels to the transformed variables and the recode statements used to create those variables and clearly identify the data files comprised of only transformed or analysis variables and clearly mark transformed variables stored within the original variables. You can describe the source of the transform variable or the method for deriving it by depositing the recode statements or a more extensive explanation in the documentation. In some cases, the recode statements and explanation may be deposited if the secondary analysis can faithfully reproduce the transform variable. We also suggest that you include technical variables in the data file that are needed in order for statistical inference to be valid, such as weights, non-response adjustment, survey design variables such as stratum and cluster, case deposition indicators, and other related variables. The documentation and labels should clearly describe how the variables were constructed, how they should be used, especially if different analyses require different weights or disposition variables. Imputation flags should also be keyed to the corresponding variable, and the method of imputation should be fully explained in the documentation. This just helps future users not make mistakes. We also ask that you reconcile univariate statistics on each variable. Secondary data users confirm that they're reading the data properly by comparing the documentation with the univariate statistics they produce from the data. Data producers are best positioned to reconcile the case counts, out-of-range codes, skip patterns, and univariate distributions before deposit. Secondary analysts resort to unsupported assumptions if they're unable to reconcile the data with the documentation. And we also ask that you provide all documentation needed for others to sufficiently understand the data. HMCA often distributes original project documentation with the data. Relevant documentation might include research project documents such as a data management plan, informed consent, final study protocol, final amendments, statistical analysis plans. It might be description of post-processing decisions such as weighting, imputation, and recodes. It could be descriptions of any de-identification changes made to variables to address disclosure risk. Measures, assessments, case report forms, or other data collection instruments are always valuable. Original data documentation that's not embedded in the data file or instruments, such as a code used for analysis or to create the derived variables, and any working papers, technical reports, or publications associated with the data collection. HMCA also provides a depositor checklist, which is a more concise list of the materials required for depositing with HMCA. All of the tips from the previous slides can be distilled into sort of the following checklist. First, the main items that need to be addressed are in the analyzable data set include making sure it's been anonymized. That can be with safe harbor or the common rule. Variable labels for all variables, value labels for all variables, needing these labels on discrete codes, missing data standardized, derived variables containing summary scale scores or used for publication, design variables, stratum, cluster, and final weights, and linking variables included for data sets that can be combined. The checklist also contains an extensive list of documentation that's often helpful when processing a study and making it available for secondary analysis. Not all of these documents will be applicable to all studies, but we ask you to consider if you have something similar that could provide value and accurately describe the study in the original analysis. Documentation includes data management plans, final study protocols, any amendments, informed consent, statistical analysis plans, analytic code, code used to create derived variables, citations to publications based on analysis, measures, assessments, case report forms, or other data collection instruments, de-identification notes, things like that. And depending on the sensitivity of the data, it may need to be released as restricted use. If this is determined to be the case, the data depositor's institution will need to review and sign the ICPSR restricted use data deposit and dissemination agreement before your deposit can be reviewed by HMCA staff and queued for curation. The RWJF sets forth the requirements of the depositor and their institution and defines ICPSR's obligations. It allows ICPSR to receive your data, to store the data on our restricted server, to make the data available for secondary use. Basically, this document clearly stipulates who is responsible for what. Institutions may want to make minor changes to this document, so it's recommended that this process is started as soon as possible, and any deviations need to be reviewed and approved by the University of Michigan's legal team and the Office of Research and Sponsored Projects. Even deposits that do not require a formal RWJF still have a standard agreement that you'll be prompted to agree to in submitting the data. If anything in the tips or in the checklist needs additional explanation, HMCA also provides a guide to social science data preparation and archiving. This guide provides a comprehensive overview regarding data management steps that should be taken prior to depositing data with HMCA. The topics in the guide include details about ICPSR and HMCA, such as how do I deposit data, and the importance of data sharing and archiving. It includes proposal development and data management plans, including a summary table of elements of a data management plan, project startup, data collection and file creation, such as best practices in creating research data and best practices in creating metadata, data analysis, and addressing confidentiality issues. All right, so after all those considerations, we're ready to deposit with HMCA. After clicking on the Start Deposit button on the deposit data page of the HMCA website, you'll be prompted to create a login account or log in to use the ICPSR Deposit Manager. Once you're logged in, it will take you to a new deposit project that looks like this. This provides you with a unique project number circled in red here so that you can stop and save at any point and come back to the deposit later. On the right-hand side of the deposit form, there are a number of action buttons. The Share Project button circled in orange here allows you to share the project with other members of your study team. And you can also share it with HMCA's project manager, that's me, if you need any help along the way or have questions about your deposit. Below that orange circle is also a change owner button in case the person who started the deposit wants to delegate the ownership of the project to another study team member. And at the top of the deposit, here in the bright blue circle, you'll find the Upload Files button and some related buttons. This is the section where you can upload all data and documentation. There are options to create folders and import zip files, but we're sort of agnostic to the organization of the files, so long as they're all there and they're clearly labeled or documented. The only required fields on the deposit manager metadata are the PI and a summary description. They're circled here in green. That being said, the more fields that can be filled out, the more accurately we'll be able to describe your data and make it findable for secondary use. And later in the presentation, I'll show you what the study homepage ends up looking like so you can see how the things that we're asking for really do contribute to the final project. So besides the basic project description, we also ask questions related to the scope of the project. This includes relevant subject terms, geographic coverage, time period, collection dates, universe, data types, and collection notes. These fields are especially important as geography and time period are included in HMCA study titles to assist secondary users in knowing if they're looking at the right thing or if it makes sense for the type of research they're trying to perform. The third section of the metadata in the deposit manager covers methodology. This includes fields such as response rate, sampling, collection modes, scales, weights, units of observation, and geographic unit. And last but not least, we collect citations for related publications. These feed into HMCA's bibliographic collection of publications. HMCA currently has almost 6,600 data-related publications, including submissions from the original study team and from secondary use. The secondary users, as part of their data use agreements, are required to correctly cite and report their publications to HMCA, which is one of the ways that you can track the impact of your data after it's been deposited. Once you've filled out all the relevant information, we ask that the PI or the primary investigator push the blue Submit to ICPSR button. It's circled in red here. This will lead to a screen allowing for a review of the deposit and then a pop-up with the terms and the conditions. The terms and conditions cover questions regarding disclosure risk or confidentiality, copyright, and a 5-point data deposit agreement. If for some reason the PI is not able to submit the data, The last section circled in red here allows for the upload of a document granting permission for another study team member to submit the deposit. We prefer that the PI do it since they technically were the primary investigator on the study, but like I said, there are ways that we can get their permission to do it as well. So ICPSR's curation standards compare the information in the data set and the documentation and enhance the information as needed to make a well-described curated data set. So throughout the curation process, HMCA may ask data producers to resolve questions about the data set itself because it's the foundation for many of ICPSR's data products. The curation process uses information stored in the curated data set to generate several ICPSR data products that are on the study homepage after data release. The variable search on that online analysis and curated data for SAS, STATA, SPSS, and R, and an ICPSR codebook with frequencies and or summary statistics for each data set. It's important to note that the curation team does not make any changes to the deposited files of a substantial nature. Any changes a curator makes during the curation project are made on a copy of the files and are documented through an annotated syntax file that reads in the deposited data set and outputs the curated data set. Curated data sets are thoroughly quality checked by a senior curator and a curation team supervisor. When needed, such as for discrepancies found within the files, or if there's a disclosure risk remediation, such as collapsing or masking variables, HMCA will consult with the data producer to see if we can get a resupplied file with those requests. Documentation from the data producer can be downloaded separately, as it's always included when obtaining the data set. And project descriptions from the deposit may appear on the homepage with some alteration to conform to curation standards. The project description that the data producer provides in the deposit workspace gives the curation team information for the study homepage, which is why I emphasize filling it out as thoroughly possible with this in mind. So this sort of shows the workflow from when you're in the deposit workspace and you upload all of those files and fill out the descriptions. Then we have our curation process where they take that information, they do a little bit of cleaning and conforming to our standards, and then it's released to a HMCA study homepage. So on this slide, I'm showing the result of the curation process, and I'm highlighting some items on a study homepage that are most relevant. So the item number 1, the study citation, is comprised of the fields noted by the dark blue rectangles. The study link gives you the citation to use for publications and presentations. Number 2 is the direct object identifier, or the DOI, which is highlighted in the purple rectangle. The DOI is also included in the study citation, and it's the persistent, stable link to the study homepage to share with others. So even if a version of the study changes, this link will always take them back. Number 3 is a link to the study series page, and it's yellow here. From the series page, you can view all the study homepages for data from multiple waves or associated data collection efforts and search across all variables and data-related publications in that series. On the next slide, I'll show searching the variables within an individual study as well. Number 4 here in the bright blue box shows the study utilization analytics. It's up to date. It provides on-demand information about user downloads or study files. And you can access also links to the data-related publications based on use of the data set, which is number 5 in bright green here. The next slide shows additional items on the homepage about data and documentation. So this slide shows the remainder of the ICPSR data products as they appear on the study homepage. So if the data are public use, you can use the online analysis features, number 6 here and highlighted in orange. The Explore Data tool is sort of like an interactive code book in which users can do simple analysis but no weighting. And the Analyze Online tool allows users to weight the data, recode or create new variables, and run frequencies or crosstabs and regressions. Number 7 here, the light blue rectangle is the project description. It provides information about the study purpose, methodology, sample, and more, and uses information provided in that deposit workspace as mentioned earlier. Number 8, sort of in the middle of the page there, is the data and documentation tab. You can download all of the data and documentation at once using the download tab or by data set from the data and documentation tab. So for restricted data, the download package only includes study documentation. Number 9 on this page is the variable search, and it's the brighter orange. You can search all variables in the study or by data set and compare the content of several variables side by side. And number 10, highlighted in red, is the Access Restricted Data tab. This connects users to the restricted data use application to complete access for restricted data via either the secure download or the virtual data enclave. So after someone clicks the Access Restricted Data tab, they have 2 options, secure dissemination and the virtual data enclave. For secure dissemination data, HMCA offers users the ability to request the data via an online application through the ICPSR Data Access Request System, sometimes referred to as IDARS. It looks like this. This is a screenshot of one of those applications. Users must sign in to the application system, and the restricted data application requires names, titles, and institutional affiliation of investigators and the staff, description of proposed research, information on data formats needed, data storage technology, and data security, and approval for the research project from an institutional review board of the applicant's institution, and a signed data use agreement between institutions. Upon completion, requests are reviewed by HMCA staff, and when approved, the encrypted data are sent to researchers via a secure link. HMCA does not typically evaluate the scientific merit of proposed research questions. We just evaluate the security measures undertaken by the researcher and verify that all necessary paperwork has been submitted. This is a screenshot of the virtual data enclave application. The VDE provides access to restricted use data via a virtual machine launched from the researcher's own computer but operating on a remote server. The virtual machine is isolated from the user's physical computer, restricting the user from downloading files or parts of the files to their physical computer. And the virtual machine is also restricted in its external access, preventing users from emailing, copying, or otherwise moving files outside of the secure environment, either accidentally or intentionally. To receive output files or other files from the VDE, users must request a disclosure review from HMCA staff. The system can be very beneficial to those who are unable to meet the requirements of an IDARS data security plan or who need to collaborate with researchers at other institutions. The virtual data enclave does have its own data security plan that you agree to, but since the machine is virtual, a lot of what's required is already present. The VDE Manage application collects information regarding the description and abstract for the proposed research, any related funding, and the names and titles and institutional affiliation of investigators and staff. So at this time, please be sure to put any questions in the Q&A box. And to find out more, you can visit our website. You can email us at hmca@icpsr.umich.edu. We are always willing to meet with potential depositors. If they have any questions, we can point out specific resources that we have available. There are video tutorials for using the deposit manager. So we have a lot of resources at our disposal through ICPSR and through HMCA to make sure that our RWJF data is planned for and archived. I'm gonna stop sharing my screen. So I have one question that asked if any RWJF data can be deposited at HMCA. You can always email to ask, but typically you would know ahead of time if your data was required to be deposited. It's flagged in the RWJF grantee system, which lets you know if you need to create a data set as part of as part of your grant with RWJF. But if you contact us, we can always double check that for you. I also have a question about cost. So there is no additional cost to deposit the data. This is part of the grant that HMCA receives from RWJF to curate the data. And there's no cost for accessing HMCA data as well. That's free of charge. I have another question that says, my data are sensitive. Can you still archive data like this? So yes, you can deposit sensitive data with HMCA. There are a couple of things that we'll consider. So first, we'll do one of those formal agreements, the restricted data use and dissemination agreement with your institution. Once that is cleared and your data is archived or is deposited, the curation team will also review it for a disclosure risk review. Depending on their findings, we might ask for certain changes if we want to make a public file available, but if the data is particularly sensitive, then it would be in one of those restricted formats, either secure dissemination or the virtual data enclave, depending on the severity of that sensitivity. Please feel free to ask any additional questions. You can always email hmca@icpsr.umich.edu if you think of anything later that you wanted to ask. Again, this is our website. The QR code should take you directly to our website. There's a contact us page on there. And otherwise, I want to thank you so much for joining us today and for using this resource to deposit your data with the Health and Medical Care Archive.